my name is James McDermott. I'm a medical student at UCLA. I worked with my team at Georgetown University and MedStar Georgetown University Hospital to present the impact of clinician linkages on unequal access to high-volume hospitals for colorectal cancer surgery. My mentor on this project is Dr. Waddah Al-Refaie. I want to thank the Western Surgical Association and the Journal of the American College of Surgeons for the honor to share this research. Previous literature has suggested that high-volume hospitals are associated with improved outcomes for surgical cancer care, particularly for complex surgical procedures like rectal cancer surgery. There are disparities, however, in the utilization of high-volume hospitals among racial and ethnic minorities and low-income populations. These disparities persisted despite ACA's Medicaid expansion and trends towards regionalization. This emphasizes the importance of evaluating other factors that contribute to disparity, like clinician referral patterns. Previous studies have shown that clinician recommendations are a strong determinant of where patients will undergo surgery. A trusted source, such as a physician, and choosing a hospital that is familiar and comfortable play the greatest role when considering where to receive surgical care. Given this, for patients with colorectal cancer, referral patterns among primary care clinicians, specialists, and surgeons are likely strong influences in the patient care pathway and should be evaluated. It has also been shown that poor coordination between primary care clinicians and specialists result in disparities in access and cancer outcomes among racial and ethnic minorities. The impact of clinician networks and referral patterns on access to colorectal cancer surgery at high-volume hospitals is unknown. It is important to understand how clinician networks may contribute to existing disparities in access to high-volume hospitals among racial and ethnic minorities and Medicaid and uninsured patients. For this study, our dependent or outcome variable was the receipt of colon or rectal cancer surgery at a high-volume hospital. Our independent variable was having a referral linkage, which was defined as having 9 or more shared patients between 2 clinicians. We evaluated 2 separate linkages. Linkage 1 was from the primary care clinician to specialist, which was defined as a gastroenterologist or medical oncologist. Linkage 2 was from specialist to surgeon, which was defined as a general or colorectal cancer surgeon. When examining referral links as a dichotomous indicator, unadjusted odds show that patients who have a primary care clinician with at least 1 referral link to a specialist connected to a high-volume hospital were 4 times more likely to undergo colon cancer surgery at a high-volume hospital. Patients who had a specialist connected to a surgeon at a high-volume hospital were more than 10 times more likely to undergo colon cancer surgery at a high-volume hospital. A similar pattern was observed among the rectal cancer cohort. Patients who had a primary care clinician with at least 1 referral link to a specialist were nearly 6 times more likely to undergo rectal cancer surgery at a high-volume hospital. And those who had a specialist connected to a surgeon were nearly 19 times more likely to undergo rectal cancer surgery at a high-volume hospital. This data was adjusted for patients' demographic characteristics, zip code, and linkage status. Here we are examining referral links as a continuous variable. So for every additional referral link between a primary care clinician and a specialist connected to a high-volume hospital, there was a 12% increased likelihood of receiving colon cancer surgery at a high-volume hospital. For every additional referral link between a specialist and surgeon, that rose to a 28% increased likelihood of receiving colon cancer surgery at a high-volume hospital. Again, a similar pattern was seen for our rectal cancer cohort. For additional referral links between primary care clinician and specialists, we observed a 14% increased likelihood of receiving rectal cancer surgery at a high-volume hospital. And for every additional referral link between a specialist and surgeon at a high-volume hospital, there was a 25% increased likelihood of receiving rectal cancer surgery at a high-volume hospital. So in conclusion, patients of clinicians with stronger linkages to high-volume hospitals are more likely to have their colorectal cancer surgery at these hospitals. This relationship is particularly strong among specialist to surgeon linkages. These results reinforce concerns surrounding the structural barriers to care that perpetuate existing disparities in the delivery of equitable surgery. Particular attention should be paid to strengthening clinician connections to high-volume hospitals, predominantly among clinicians serving vulnerable populations. Thank you for taking the time to watch this video. We hope that you'll review our full manuscript to get a better sense of our study and its implications.